Hi, my name is Noel Bell, and today I'm chatting with Windy Dryden. Windy is one of the leading practitioners and trainers in the UK in the CBT tradition of psychotherapy. He is best known for his work in Rational-Emotive Cognitive Behaviour Therapy, RECBT, a leading CBT approach. He has been working in the field of counselling and psychotherapy since 1975 and was one of the first people in Britain to be trained in CBT. In 1992, he was appointed the first Professor of Counselling Studies, later appointed to Professor of Psychotherapeutic Studies at Goldsmiths College, University of London. He has published over 200 books and has trained therapists all over the world in as diverse places as the UK, the USA, South Africa, Turkey and Israel. I started the interview by asking Windy about the challenges of editing the Handbook on Individual Therapy. I mean, just take us through the process of editing a book like that. Presumably you're motivating the various authors of each section.
Well, I'm not sure I'm motivating them. I'm certainly chasing them up if they haven't, kept. I mean, very politely, my philosophy of editing is that you do need to be polite and persistent and patient as well. So, I mean, I think that a book like that, which has just come out in its 6th edition, and I've taken on a co-editor because, and the next one that we did, the 7th edition, I'll take a increasingly backstage approach. But I think the importance of a book like that is that you provide the authors of each chapter of a particular approach with clear chapter structure. Some people are more happy to do that than others. I think if you are, as I say, patient, polite and persistent, and you give them, you indicate to them what you want them to do, what you don't want to do, that doesn't go there, that goes here, and so I think that, if you do that, then as it's turned out, I don't think I've had to lose anybody on that particular project in terms of being let down.
And the contributions that come in as editor, are you actually agreeing with what they put down, even if it's following?
No, of course not. I mean, there are two types of survey, if you like, of psychotherapy books. One is where somebody writes the whole thing, and therefore they can presumably, hopefully, be fairly objective about the approach, but then bring out their own views. Mm-hmm. Or you really trust people, you get people who are expert in the field, and you trust them, and even though you don't agree with the content, it's not your place as an editor to actually indicate to the readership where you disagree, and I think that in that way, I think initially I did attempt to make some comparison among the different approaches, but latterly I decided not to do that, because I think people should be allowed to speak for themselves, and the editor's job is to make sure that the chapter structure is being kept to, so that readers can actually undertake their own comparison. And I think that in a way there are other chapters which actually fall outside that rubric. So, for example, you've got a chapter on the social context of psychotherapy in Britain. You've got a chapter on supervision and training. You've got a chapter on research, and that they have their own sort of structure which falls outside the chapter structure of the specific approaches. But so make sure that they're keeping to the word length, and that the chapter structure makes logical sense is again what I've been trying to do over the years, but to enable people to express their own viewpoints.
Yeah.
And I think that by and large, that's been quite successful.
For the person's background, just explore quickly why you became a therapist.
Yeah, I mean, I think that my own background is fairly typical, actually. If you look at some of the sort of research and also autobiographical pieces that have been written. I mean, first of all, I'm an only child, and I think that's a factor. I'm Jewish male, and there's quite a lot of Jewish male therapists out there. Wounded healer in the sense that I used to have a very bad stammer and was quite shy, partly because of that, but also because I was, well, I mean, I don't like the word, bullied, taken the mickey out of at school quite badly, and so that, I think, those experiences, for example, I remember thinking quite early on, I don't understand why this boy who one-to-one can be nice to me, and then, you know, almost the same day would be in a group, you know, taking the mickey out of me. So I think that kind of made me interested, first of all, in the inner life, the inner world of experience, and also the impact of, you know, of the social world. And so I actually ended up, my first degree was in social psychology at the London School of Economics, because I kind of enjoyed looking at the social context of behaviour, as well as the intrapsychic aspects of behaviour.
How would you describe REBT as an approach or a tradition?
Oh, it is an approach within a wider tradition, in my view, of cognitive behaviour therapy. We've got a number of different traditions in the field. We've got the humanistic existential tradition, we've got the psychodynamic, we've got the systemic, we've got the transpersonal type of approaches, and we've got the cognitive behavioural. So there are numerous approaches within CBT, and therefore when people talk about CBT, I just wonder if they know what they're talking about.
Yeah.
Because different approaches within CBT try to indicate, for example, there is now a growing idea that one of the hallmarks of CBT, the tradition, is that it is marked by a collaborative approach, and that's fine. But I think that, there are exceptions to that, and I don't, I think I'm sort of pluralistic and integrative enough to know that, you can't really say with any sense of confidence that this is a defining feature of an approach, and any departure from that is wrong. And therefore, while I'm a great believer of collaboration, I think that at times there is a place for didactics in therapy. I think there are times for humour. I mean, one of the reasons that I'm sort of allow myself more towards rational-emotive behaviour therapy than cognitive therapy, which is the Beck's approach, although I trained in both in the late 1970s and the early 1980s, is because I think that the structure of REBT allows the therapist to actually use a much more wider repertoire of their own personality and skills. And so, for example, whereas in REBT you would not kind of chide a therapist for being humorous unless the humour was directed at the person, but in cognitive therapy they might really be much more concerning. I gave a case conference in 1981 when I was on sabbatical at the Beck's Cognitive Therapy Centre at the time, and I think the major criticism was that I used too much humour with this person, and I could have put things without humour. Well, I could have put things out without humour, but so I'm quite interested in really the kind of the resonance between the person of the therapist and the approach that they practice. And I think that the reason I still call myself or refer to myself as an REBT therapist is that I think it is a place where I can be myself more than in other therapies. I found person-centered therapy, when I was initially trained in it, quite constraining. I think psychodynamic is quite constraining. I think there are forms of cognitive therapy, cognitive behaviour therapy, that are quite constraining. Whereas in REBT, I do actually experience that approach as being quite freeing.
Jocelyn Chaplin said to me, the way she looks at it is she gets away from the brand wars of one approach or tradition up here and another down here, that it's a broad landscape. I love that idea, because you just take from whatever you need for the client. But do you see a difference between integrative versus pluralist?
Yes, I think there is. I mean, I think that there are certain things which are similar, but I think kind of pluralism, and I'm actually editing a book with Mick Cooper on pluralism. It's going to be called the Handbook of Pluralistic and Counseling and Psychotherapy, I think. I don't know what we've agreed yet. But I think in integrative, you see, if you look at integrative, and it sounds like, you know, you're bringing things into a whole. But if you actually look at various different brands of integration, I think one of the things is, you know, I think, for example, what I hear of different approaches to it, whether it be in the place where you were trained, whether it would be Regent's College, whether it would be Metanoia, there is a sort of an under-emphasis on the cognitive behaviour.
Yeah, I'd agree with that.
And therefore, I think one has to understand what's going on there. I don't quite understand. I think it would make a very interesting research project for somebody to study when people say they're integrative, just exactly what they mean, and also why are they emphasising different aspects and not. So I think, you see, I think interesting, and how much I love Jocelyn, I might disagree with her on there, that yes, we have a broad landscape, but I think we do have our own opinions about what constitutes how people become disturbed, what are the important factors to consider, you know, what is our sort of model of the individual. I'm sure, for example, the fact that I am an atheist has really meant that I have, in my mind, de-emphasised the spiritual. I'm pretty sure about that. So I think, you know, one has to kind of always bear in mind that we are in a field. Yes, there's a science to our field. Of course there is. You know, if we don't look at what, you know, seems to be effective and what doesn't seem to be effective, what are the core ingredients. But, you know, we can't be replaced. You know, if you suddenly see a client after a year and ongoing therapy, and all of a sudden the client comes in and, you know, somebody's wearing your clothes but it's not you, the person will notice it. You know, I mean, in very early behaviour therapy days, it was felt that, you know, what was important were the techniques. The therapist was the technician. It didn't really matter who was there. So you could actually turn up for your next appointment with your technician, and your technician was on holiday, and there's no problem, because, you know. But it makes a difference. You know, we can't say that one of the most important aspects of therapy is the relationship, and then say, well, look, one part of that is not important, but, you know, the person of the therapist. Yes, it's a dynamic and interactional feature, but the therapist brings him or herself to it, and, you know, we bring ourselves to what we consider to be integrative, what we consider to be pluralistic. I mean, I, for example, I'm all for giving clients a say in therapy. I mean, it'd be silly if you didn't. And so I agree with the basic pluralistic idea of really taking seriously what clients say. But clients are clients. They're not professionals. They don't read the literature. And so for example, I mean, I'm writing a chapter for a handbook on anxiety. Now, if you ask clients about anxiety and what they want to avoid, they want to eliminate anxiety, the very things which perpetuate it. And therefore, I think, for me, yes, let's take our clients' attitude seriously, viewpoint seriously, but let's inform them. We talk about informed consent being an ethical principle in psychotherapy. Yeah, let's let's bear in mind that when we're informing them, we're bringing certain viewpoints. I'm not suggesting that we, for example, we kind of say, okay, now let me tell you what all the major approaches say about anxiety, because that's a waste of time. But I think I would want to, if a client says I want to avoid this, I say, well, look, I can understand that, but let me outline a viewpoint that might help you to kind of rethink that, and then I actually bring that that to the fore. So yes, we bring ourselves to our integration. We have different ideas about integration. So in a way, and I'm sure that that's true of different person-centered therapists, different REBT therapists. I edited a book for Pete Saunders' outfit, PCCS Books, and I called it Idiosyncratic Rational-Emotive Behaviour Therapy, and I think they followed it up with idiosyncratic person-centered therapy. So what I'm saying is, even though there's some ideas, people bring themselves to their ideas. So yes. So when people say, "Oh, I've had CBT and it didn't work," well, that could mean a multitude of things. One of my clients recently said that he had CBT and it didn't work, and I said, well, would you mind me having a look at the work he did, because he kept, they have records in CBT, and he brought this thing, and I could see that in a way that the core aspect of his problems were being missed. In fact, but that was from an REBT perspective. Now, I may be wrong, and what I'm going to be doing him over the next few weeks and months might be equally ineffective. But we all have our ideas, and I think this, in a way, yes, we do need to watch the brand wars, but I think we do really need to focus on the idea that that people are bringing their own versions of specific approaches. They're bringing their own versions of pluralism. They're bringing their own versions of integration. And just because two people are integrative, they may virulently disagree with one another.
And they're bringing different toolboxes, if we use that analogy, or they're playing different instruments. Another question I have, and it's something I have a dialogue with myself about, in terms of integration versus specialist. So, if you're Kleinian, or classical Freudian, or even Jungian, or person-centered, or existential, you're that. And you've been specifically trained, and your supervision is centered on that. If you're integrative, for instance, I have sometimes used the empty chair technique, but I haven't been trained specifically in Gestalt.
No. I have this idea of REBT as a form of what do I call it? Theoretically consistent eclecticism. Yes, I might use the empty chair technique, but for a purpose that would be very different from its original creation. Like, I'm not necessarily there to heal splits within the different parts of the personality, but to facilitate dialogue between the irrational and the rational voices within the individual. So I think. But I think that in a way that the thing about integration is basically I think what unites people within integration is the idea that no one specific approach has it all, says it all, and that I think probably unites people who are integrative.
Because otherwise we're fundamentalist.
Well, I think. I don't think necessarily. Well, you can be fundamentalist, but I think it's perfectly possible to say, I am a person-centered therapist. I recognise that other approaches are perfectly viable. Mm-hmm. I don't practice them. I'm quite happy to refer people. I don't think that person-centered therapy is the final word. I don't think it's an absolute, correct statement of reality. But this is my specialty. And I think you can hold that view without being fundamentalist. I think you can be fundamentalist, and I think that what really, like the idea, which was attributed to some analyst in training, and it gets passed around, but what was said was the beauty of psychoanalysis is that even though the patient may not be improving, at least you know that you're doing the right thing.
Right.
I think that we want to avoid that.
Yeah.
But I think it's perfectly possible to be a specialist and say, well, look, no, I'm sorry, this is what I do, and I recognise that this is not for everybody. It's when you say this is what I do, it is for everybody, and it is the best thing out there. That's, I think, that's sort of kind of approaching fundamentalism.
Yeah,
and what really, and everybody else is wrong and misguided. I think that is, the three kind of criteria of fundamentalism in psychotherapy. I'd be very surprised if there are people who believe that still. I'd be very interested. And I think, in a way, it's easy to kind of talk about the modality wars. I'm not quite sure. I mean, yes, there might be a war against CBT. I mean, when I first trained in CBT, one of the first people in the early 1980s. I mean, it wasn't attacked because it wasn't a threat. We only attacked things that are threats in a way. And what is threatening now is that people are getting threatened by the idea that this is something which you really do have to learn if you want to survive in this field sometimes.
Yeah.
Or particularly in the NHS.
And there's the issues of evidence-based medicine though as well, isn't it? For the profession, it's like difficult to prove something where CBT is claiming to prove through nice guidelines.
Well, I mean, it is. I mean, if you look at the nice guidelines, it's basically saying that we will include things which have been shown to be effective. Now, I think there's lots out there that haven't been shown to be effective, but they haven't been shown to be ineffective either. They haven't been shown to be anything. So, for example, I think you would. Yes, there is a research literature on the outcome of TA and Gestalt therapy and existential, but it's probably not as rigorous. It's probably not as frequently found as studies on CBT. But in a way, that is really kind of looking at things from a very holistic viewpoint. I think what I'm interested in is really kind of looking at the individual differences among people who regard themselves as being pluralistic, integrative, as well as what unites them, what is actually individualistic about them. I mean, if Rogers was right that one of the core ingredients is that the client experiences the therapist as being genuine.
Yeah.
Then I think then we have, and there are people out there who are training in CBT and don't want to train in CBT, but they believe that they have to train in CBT, otherwise they might lose their job. What is that saying about their genuineness?
Yeah.
I don't know. I mean, I don't know the answer to that question. But,
I mean, they're big questions. One of the questions I asked John Rowan, I asked him, do you call yourself a transpersonal practitioner? And he said, oh no, I'm an everything practitioner.
He's an everything practitioner. Yeah.
So, just again on that field of integration, holistic, you've mentioned the word atheism. Can I then just ask you about Jung, alchemy? Where is there a soul? I mean, it's as long as Descartes and before, the whole issue of dualism and.
Yeah, I mean, I mean, yes, I mean, you are entering into a realm of human experience which I tend not to tread, because I personally don't believe that we have a soul, but if that is a concept which is helpful to people, then that's fine. I'm not going to knock them. I think one of the things that that has helped me is that I think editing the individual therapy handbook has helped me to be respectful. And I think being respectful doesn't mean that you agree with people. It means that you disagree with them, but you know that they recognise that they might be right and you might be wrong. And I think that's an attitude which is very important in life as well as as a therapist. That I might be wrong. But I've read Jung. I just can't. It's like a different experience. Actually, I was in Jungian therapy for a while in my 40s, and my therapist got kind of fed up with me because she said to me, Winnie, how can I help you if you don't tell me your dreams? I said, well, I don't dream. Well, I obviously do dream, but I don't remember them. And so we sort of came ground to a bit of a halt there. Originally, I tried that because I was going into my 40s, in midlife. I thought I'd sort of anticipate that. But no, I'll try to read books on alchemy and the soul and this whole transpersonal. It's it's not for me. Yeah, it doesn't mean that and if people do think that way, I say to them, I may not be the best person for you. My dear late friend Arnold Lazarus once said, Windy, one of the most important skills that you can develop as a therapist is the skill of referral.
Because it's part of an ethical consideration as well, isn't it? That we know the limits or the inappropriateness of seeing someone, that we might think someone else is more appropriate. Yeah,
because if people, come in, I learned that lesson quite early on, and this woman at the Centre for Cognitive Therapy came in and she had been in experiential psychotherapy for many years, and she really didn't get on with cognitive therapy. And she said, I want more of an I-thou encounter with therapists over time, and that's not it. So I think one does have to inquire of people what they think is going to be most helpful to them. Now, you might then say to them, but you might be wrong. Are you willing to give it a go, and have a trial for a number of weeks to experience it? I think that's fine. But if somehow somebody who really wants transpersonal therapy ends up at my door for whatever reason, I'm going to refer them to you, or to John, or to Jocelyn.
So what if we take... Well, we can probably take Maslow, we can go to John Wilber, who talk about a spectrum of consciousness. So when you read that, what's your thoughts?
Well, my thoughts are this, that yes, obviously we have a conscious mind. Yes, obviously lots of things go outside of our awareness. I think that's important. I don't really kind of go into the differentiations that Ken and John do, because I think they're coming to it from a different position. They probably don't go into the differentiations in terms of cognition that I might make. And so I'm going to be doing therapy different from John, and John's going to be doing therapy different from me. And vive la différence.
Yeah.
And I think, actually, I'd hate it if we lived in a world where everybody was a CBT therapist.
Okay.
Yeah, I think that would do a great disservice to the broad spectrum of views that people have about themselves, other people in the world.
Which one single book, of any book, your own or anyone else's, has most inspired you, and why?
Well, I think probably the Reason and Emotion in Psychotherapy, which was Albert Ellis's first book in 1962, because I think it was really the book that really introduced me to this whole business of our belief systems and how they impact on our emotions, and so that one would be it.
Who would you not work with and why? What type of client would you not work with?
I wouldn't say I wouldn't work with anybody. I tend not to do very well with monosyllabic male adolescents.
Are long-term goals appropriate for long-term therapy?
Yes. I mean, I'd be interested to, why would you have short-term goals for long-term therapy? You might have long-term goals for short-term therapy. In fact, the Albert Ellis Institute, in their advertising, refers to ReBT as short-term therapy with long-term results. I'm in two minds about that being a good slogan. But yes, I mean, I think that, Now, I think that people in long-term therapy are often there because they need it for maintenance. They really do. They don't either have anybody else in their life to talk to, and therefore the therapist, remains an important part, or that they need that ongoing care because of the nature of their problems, and therefore I think that's a perfectly legitimate idea. You probably won't get that on the NHS. You might do, but I think that actually in private you don't, because you'll soon be regarded as being chronic and you won't be funded. So often people who do need ongoing therapy will have to end up funding it themselves for a whole host of reasons. But yes, long-term goals for long-term therapy, sure.
Is self-disclosure allowed in your therapy as a therapist?
Oh, yes. I mean, I did my PhD on self-disclosure, actually, and it's one of the reasons I got interested in the field of counselling. Definitely, I think that self-disclosure, not with everybody, because I remember talking about my experiences with a client in Philadelphia, and she said, "Young man, I'm not paying this clinic good money to hear about you and your problems. Please concentrate on mine." So I think, like with anything, is you kind of, but some people do, and for example, some people do resonate when I tell them about my experiences indeed with anxiety over my stammer and how I overcame, my fear of talking in public, and I think that is fine if they're interested. Fine, I as long as you're not imposing yourself on people, if you can actually help them, and then ask them, was that helpful to you?
Are you the same person in the therapy room as you are outside?
Pretty much, actually. Yeah, I think that is something which I do recognise. So I'll make some. I make some stupid jokes outside therapy, and I make some stupid jokes inside therapy. I do think that people, by and large, want a human-to-human encounter. Now, if that means that I'm not encouraging the transference, one could argue that. I think that is an important sort of feature for me, so that I'm bringing myself to the work. The client's bringing their self, and hopefully out of that interaction, some therapeutic change will occur. That's why I can understand why people want to use computerized CBT. But if you look at the research, a lot of people are reluctant to use computers, and a lot of people. Some people get a lot out of self-help books and don't need anything. A lot of people like to read that along with seeing a real human being. And I think that this field that we are in is about the uniqueness of two human beings coming together for a particular purpose, that is to help one of them. And I think that anything that really interferes with that, and so just kind of very briefly, my concern is about the IAPT program, the increasing access to psychological therapies. Yes, I can understand the reasoning behind it, but if a client brings up an anger problem and the person's not trained to deal with it, they have to step them up. Well, I think I don't see that as being a great way of actually treating somebody.
Yeah. Is it okay for a therapist, in your opinion, to embrace social media to promote their business?
Well, people do that. They write blogs, right? And they write. I mean, I think there's a difference between using social media to get ideas across, and you might be doing that in order to get more clients in, and using media for advertising purposes. I don't really think that's a great thing. But I mean, I think that blogging is fine, and I'm friendly with Raj Persaud, and he blogs all the time. Whether it brings him in business, I don't know, but I can't see anything wrong with the communication of ideas. I mean, look at Susie Urbach. She's always, she may not, I don't know whether she blogs or not, but she's always in the media, and she's so as far as I can see, extremely ethical therapist. She may get, clients from it. That's it. People do. I mean, I do once a month a meetup group. I do live demonstrations of therapy. As a result of that, people have referred, a couple of people to me. So,
God or atheism?
Sorry?
God or atheism?
For whom?
For you.
Oh, well, atheism, I think.
Freud or Jung?
Freud.
Why? We've kind of touched on it already.
Yeah, I think it's sort of less spiritual for my taste.
Humour in the therapy room?
Definitely. Most definitely. I think as long as you're not poking fun at people, as long as you can actually help them, as long as you're not using it as defence, so that to kind of, so that they can avoid their pain. I think humour enables people to stand back and look at things from a palatable perspective sometimes. So yeah, I'm all in favour of that.
If someone was thinking of embarking on training in counselling and psychotherapy,
yeah,
in 2015,
right,
what would be your one sentence as advice?
Make sure that what you are going to be training in resonates deeply with yourself.
You talked about Alfred Adler had done this before.
Yes, I believe he had. Yeah,
live sessions.
Did live. Yeah, I don't know too much about that, but I understand he did that. Yeah.
So this takes place on Meetup.
Meetup. Yeah. Yeah. We have a UK CBT Meetup group which has got over 1,500 members. Luckily, not all of them turn up, of course, because we'll be, but we get about 60 to 70 to 100, depending on the time of year and depending upon the topic.
And a volunteer is from that group?
I give a lecture on a topic, say procrastination, or I'm going to be talking on the 5th of November about jealousy and envy, and I'll give a lecture on that, and then we have a little break, and then I'll do a couple of demonstrations from the audience with people who've got that particular problem. And then we, I talk with them for a while, and then we get questions from the audience, observations from the audience, and a good time is had by all, I think.
What do you do when you're to relax, when it's not psychotherapy, counselling?
My wife and I go to the Arsenal, which, although it's not very relaxing these days, we watch films. We go for if we go for walks. We have a place in Eastbourne which we go down to once a fortnight ish to chill out. And so there's plenty of opportunity to relax.
I mean, it's a big topic. Maybe we'll think about doing another in the future around the whole kind of neuroscience and.
Right.
Have you heard of Jeffrey Schwartz's book, The Neuroplasticity, and that the plastic
brain?
Yeah,
I'd like to see how that's going to practically change the working life of everyday therapists.
Because I was blown over by the book. I just thought, it incorporates the Buddhist mental force idea.
Sure.
And I thought, not only is it proven scientifically that you can affect change, but you can from a kind of, if you want to use the loose spiritual Buddhist.
Sure. But as I say, I'd like to see a clear exposition about how a therapy would unfold without bearing that stuff in mind, and where that stuff is borne in mind. So I'm going to reserve judgment until I get the nitty-gritty. Okay.
Thank you very much, Windy. It's
My
wonderful. My thanks to Windy for his generosity, for both his time and his insightful contributions to my questions. For more counselling and psychotherapy podcasts, visit noelbell.net/podcasts.